Hi, Michael Bloom, chiropractor. I actually got asked a question this morning by a friend of mine who actually doesn't have much idea about what I do, but he does know I'm a chiropractor. And he said, so how long do people stay coming to see you? Is it for a week or 2 weeks, or are they generally right within, a week, less than 2 weeks? I said, well, you'd be surprised, because actually many people are coming to see me for months or years after they first come. And now you may think that's unusual and that's weird, and why would you do that? Well, there's a reason why people do that, because they're not being coerced and they're not being forced into doing that. They're doing that because there's a transition period people tend to go through when they see a health practitioner. We see a health practitioner when our life is getting disturbed and we can't do what we want to do anymore, or we're worried that the way we are is just going to worsen. They're the two common reasons people start with a health practitioner. Then a good practitioner understands you can't solve these build-up problems immediately. It takes time and it takes planning. So as you proceed through a process of working with someone, which usually takes on several modalities. So it's your hands, your advice, your home exercises you're giving people, maybe some nutritional advice, maybe some posture advice, maybe some pillow advice, maybe some bed advice, some nutritional advice. You get the picture. As you proceed through that, you give the body a chance to evolve and to heal. And the healing process and the healing duration and time, well, that will vary from person to person. There's factors such as your age, your lifestyle, your genetics, and definitely your diligence to following a plan and a program through properly. We all know we can do things like two people can do the same thing. Two people can go to the gym and follow the same plan, and one will get amazing results and one won't, because one's just doing it and one's doing it with enthusiasm and really utilizing that time to the maximum of their capabilities. So why are people potentially coming to see someone like me months, if not years down the track? They've gone through their initial plan, their initial improvement. The reason they first came in is long gone. It's in the rearview mirror. It's a simple answer. The answer is they feel better when their spine functions well. And if you feel better and you are inclined in the way you view your life, that you want to live life to the full and feel well, you may well continue above and beyond the first reason you consulted with someone. That is an unusual way to think when you talk to people that are in a medical setting, because often they are just putting out the spot fire that happens, wait for the next spot fire, rather than helping someone maintain a better quality of life long term. Now, I'm not trying to denigrate any other professional, because there are people in all professions that have a long-term view. But I'm just trying to say that when you see someone for a long period of time, the reason you are still 5 years down the track, it's not the reason you started. My friend understood what I was saying when I was having a chat to him. I saw his eyes wide and open, and I saw his head slowly nodding. I think he was starting to even reflect upon himself and his own way he lives his life and his own health decisions. And maybe he'll decide to do some things in his own health journey down the track that help him longer term, not just put out the fire, wait for the next one, put out the fire, wait for the next one. Rather, embrace positive change and run with that momentum. I hope this has been of use to you, and I hope it might have motivated you if you need that motivation. But wherever you are, stay healthy and stay well, and I look forward to communicating with you soon again. Thank you very much.